Welcome back to the table. Go ahead and kick up your feet because we are talking about them today, how to take good care of them. You've already met Dr. Porscha Bailey. She's the board-certified podiatrist who says she can always tell when there's a health problem that's starting in the feet and then works its way, travels to other parts of the body. It's the stuff that she does for a living. And joining the conversation is Erika Allison. She's the owner of the Foot Spa, New Feet Medical Pedicures. Her nail techs treat clients with chronic illnesses, ingrown toenails, and toe discoloration. Welcome to the show, Erika.
Thank you for having me.
It's good to have you here. And I got to ask you the same question I asked Dr. Portia. How did you end up working on people's feet for a living?
Believe it or not, it's a very similar story. My grandmother didn't tell me I was going to be a pedicurist, but I was never a fan of feet. And not just feet, but problematic feet. People that have issues.
I like how you put that. That's it's not judgmental, right? Because everybody's got a little something going on.
We all have a little something going on.
But to call it problematic.
Yes. So when I actually drag raced motorcycles. That carried me from California to Georgia. And I know.
Wow.
I know. And when I was 28, I realized I could not make a living off of racing motorcycles. And I ended up going to nail school. And and while I was in nail school, I realized that there was a significant amount of people who had issues with their feet and they had nowhere to go.
Right.
Although we always refer to podiatrists, not all podiatrists do pedicures, so they don't have foot spas.
That's true.
Yeah.
That makes sense, right?
Absolutely.
So we're looking at, our viewers are looking at, and again, we say we're grown, right? So we're looking at feet. No judgment. Don't you say anything. We've got folks, these are your clients,
yes,
right?
Yes.
So let's talk about what we see, before and after.
Yes.
I think the picture in the top, that what is that?
Well, I don't know what it is because I am not a physician or a lab. So one thing about nail technicians is we do not diagnose. That is illegal.
So let me do this. So what is that? When you start to get the dark nails stock, what is that a sign of?
More than likely, that's what we call onychomycosis or toenail fungus. Could even be a little bit or a combination of both. Nail trauma, where the patient has had some sort of trauma to the nail, causing it to lip or become thickened.
Okay.
Yes.
Both great answers. I love it. Please continue. So what do you do when you see that and someone says, I've got to get my toes pretty?
Right. Well, the first question I always ask is if I see any issues is, have you seen a podiatrist? And that opens up a lot of conversations on why they're sitting in my chair now. A lot of the times they have, and they just didn't see any results. And a lot of times they didn't see the results is because they weren't getting pedicures on top of that. Or they may have been given a topical and their nail is really, really thick. And topicals need a thinner nail to penetrate in order for it to work.
Dr. Portia, I see you.
Yes.
Go ahead.
That is true. So usually when we want to use a topical as a treatment for toenail fungus, you want to debride or really get the nail. Get the nail as thin as possible so that the topical,
file it down.
So you can file it down however you need to make sure that the topical medication can actually penetrate the nail.
So when the nail is dark for a long time and starts to look like, it's crumbling, right? That should not last for a long period of time. At what point should you say, you know what, I need to just go ahead and go to a podiatrist before I keep trying to just paint over it in case there's something deeper issue here?
In my experience, the sooner the better. At the first signs, come and see a podiatrist so we can treat it. When you let it go on for years, it's probably going to take that long to resolve.
Right? Yeah. It didn't happen overnight. It's going to take a while to treat it. Right. Some of the other issues that we know people, especially Black women, have to be mindful of: diabetes and the impact. You can't just handle a diabetic foot the same way, and I think that surprises people.
It does.
Explain.
And I think it does because there's really nowhere for them to go until I opened up New Feet. So with people that have diabetes, there's a lot of things that you need to consider when you're getting a pedicure. One is sterilization. You don't want to go somewhere that is not not only are some salons not disinfecting, they're not even doing anything. So disinfection is a great level, but sterilization is the best.
Right.
And that's one thing about medical pedicures is we have autoclaves. We're very clinical.
And an
although we're not-
autoclave, explain that for folks who don't know.
Yeah, an
Device for
autoclave is a sterilizer. So if you have any microbes or pathogens, it is going to kill anything. This is what surgeons use.
And this is one of your customers, right?
Yes, diabetic client, yes.
So the before and after. I think what's interesting here, what surprised me is that you don't use water.
Correct. I do not use water. Now, not using water, you can still get the benefits of a wonderful pedicure, but it takes the risk of getting a waterborne pathogen. And that can happen in a traditional nail salon or soaking your feet in chairs that have jets that have not been properly cleaned.
Doctor, that was an audible. I don't know if you got the audible. Explain. That drives you crazy because...
gosh.
Yes.
It's really just a pool of bacteria infection. And another thing with our patients who are diabetic, some of them have what we call peripheral neuropathy, meaning that the nerves...
And you brought a model to sort of help us understand that.
So yes, peripheral neuropathy affects the nerves in the feet, and it basically is a blanket term that means the nerves aren't working as well as they should. So a lot of these patients are going to experience numbness, maybe feeling like...
The tingling?
Their feet have fallen asleep.
Yeah.
Tingling, pins and needles, burning, a fire sensation, or the most dangerous one of all, they don't feel anything. So
Their feet are
insensate.
just numb.
So imagine that type of patient who doesn't have any feeling, putting their foot into a water bath and the water is too hot.
And you don't even know, or you've been cut and you don't know, and then you've got the issues. Okay, listen,
Yes.
and I'm grateful that you brought that model because there's some
Yes.
other things we want to talk about coming up. You're going to meet a mother and a cosmetologist who stands on her feet for long periods of time. Devin bears it all about the aches, the pains on her feet, and she has some questions for our experts, the same kind of questions you all would have. So stick around for the answers. We'll be right back.